Today we have a special guest, and we're going to talk about teeth. How you doing, Dr. Forrest Bryant?
I'm doing great, Cookie.
Yeah,
Thanks for having me.
Well, we're thrilled that you're here. You know, Norman wanted so much to interview you today, but I said no.
Yeah.
Because I wanted to talk to you because you're the dentist to the what? The stars?
Well, I do love Norman, but you are cuter.
Well, I love that. That's great. Well, and Norman he's kind of equally got that star power. Have you noticed that?
Oh, yeah, yeah.
Well, something that we want to talk about, and I know that it's so important to you, is prevention, correct?
Sure. Prevention is so important, especially when it comes to your mouth. Especially one thing that's really important right now is gum care and gum health. New studies are showing that if you have periodontal disease, you're 7 times more likely to have cardiovascular problems. So many patients are having heart problems, and a lot of that is linked to unhealthy gums.
Isn't that amazing? Well, I know years ago, and of course, what is the one thing that you know about me that I'm so proud of?
That you flossed your teeth for 25 days in a row.
For 25 years I've been flossing my teeth. But really, I remember hearing about that you are a healthier person if you do floss your teeth and, of course, take care of your teeth.
Absolutely.
Correct? So now,
and it shows, too. That flossing, it does show, and we can't tell.
You can. I know, because I get so excited. You know, it's like I get a sticker, and I get real excited about that. Now, you have a blog, which is on your website.
Right.
And you talk about all of these things, and and I know one thing, too, is like people our age, or my age, who have like the old fillings, or I did.
Yeah.
That's not good, is it?
No, those old silver fillings, those metal fillings, there's no chemical bond to the tooth. It's just a liquid metal that's packed into the tooth, and so there's no bond. So saliva and bacteria can creep into that little crevice there, and it can get under there and cause decay. And sometimes it goes unnoticed for a very long time, and that can cause a lot of problems. The newer fillings actually seal to the tooth, and that's much better.
And much better than they
And they look better, too.
And they do look better, because when you do see someone,
like teeth.
Yeah, they look like teeth, exactly. So now, another thing that we did talk about, and in the break a little while ago, is you're talking about like the heart disease, and also like all of oral care,
right?
And also cancer screening for your
oral cancer is very deadly and very disfiguring, and it's becoming more common. And so there are some new screening techniques that are available. Very much like having a mammogram or a pap smear, you can have an oral cancer screening called Visalite in the dentist office.
So really anyone can get oral cancer, and you would think it's usually just someone who smokes.
Well,
it could be anyone?
Actually, 25% of the cases are in patients that don't have risk factors. And so the risk factors, of course, are age and smoking and alcohol and smokeless tobacco, and then there's a hereditary factor there too. If anyone in your family has other cancers, then you're more likely to develop a cancer. But 25% of the cases don't have those heavy risk factors, so it's important for everyone to get screened.
You know, I know. So I know that you are and your staff, y'all do a lot of different screenings when you go to get your teeth cleaned or whatever.
Right.
And you sort of do the whole thing to make sure that it's almost like getting a checkup.
Right. Well, we believe in not just treating our patients' teeth. We're mouth doctors, and the mouth is a pathway to your overall health. So we want to make sure that not just the teeth are in good shape, but that the gums are in good shape, and the bone is healthy, and that we want to screen for TMJ problems or an oral cancer. We believe in being comprehensive and trying to provide excellent care for our
And your teeth are awfully nice too. I was going to tell you that. I was going to say, who would you do it? Like somebody who does your haircut, when somebody's a hairstylist. Who does your teeth? You know, I was going to ask you that.
Yeah, no.
Is that not a fair question?
These are my natural teeth, but I've whitened them, and actually, my good buddy, I'll give a plug, Dr. Lou Sample did my braces.
Okay, yeah, great guy. He is a great guy. Well, your teeth do look great. Now, I know that we talked about patient ed is very important to you, and that's something that we want people to understand, but also you are a great guy and a great doctor, and you're fun and you're very approachable, and your staff is.
Sweet.
And as Norman, I love when he says we always call you a cutting edge dentist. He's painless. I think that's sounds kind of like scary at first, but it's true.
Well, my former partner, Dr. David White, was very he was well known for just being very gentle with his patients, and I learned anesthetic techniques from him on how to take great care of patients and numb them up painlessly, and we really strive very hard to give painless injections and to take really good care of our patients.
Well, you did have a great mentor. Well, I'll tell you what, we're going to take a break, then we're going to come right back.
Okay.
Okay. Okay. See, if you're at a cocktail party or even in an art gallery,
Yeah.
do people do that to you?
Absolutely, and I love it.
Do you love it? Well, I did. I told you, I was like, I've got to get
I love
in.
tea.
Oh, I got to get in that one. You
Yeah,
do. Like,
I know.
you only told me how long ago I needed to do
Yeah,
that. I know. I need to.
A couple years ago.
Couple of years ago, a while back. So now listen, we love to talk about this.
Yes.
PPM.
Yes.
Tell us about PPM. That's all I'm going to say. Tell us about PPM.
There's so much to tell. PPM stands for Pure Power Mouth Guard. It's a mouth guard that enhances performance for athletes. We're very well known for outfitting the New Orleans Saints last year, and they went on to win the Super Bowl, and they had just an amazing year, and that was really special for me personally to be a part of that, to get to go down there. And I lived down in Slidell, Louisiana, so for me, being a Saints fan, to get to be a little part of that was really special. But it's really going well. The Pure Power Mouth Guard is based on the principles of neuromuscular dentistry, which is how I got into this in the first place. And it's a type of dentistry that we do that helps patients with TMJ problems, sleep apnea, and bite problems, pain in the joints. And so we took that treatment and took it to healthy people, and lo and behold, we can actually improve performance. And so it's really pretty exciting. And we also have about 3 pro teams that are looking at following the Saints lead and outfitting the whole team. And we've got 2 Division I college football teams that are in the process of getting the teams outfitted. So it's
How
really
did y'all
been pretty
figure
fun.
out that this could do that? Pardon me for interrupting, but how can y'all figure out that this would make them? I mean, just through a lot of research.
Well,
and study,
actually, and I didn't invent this, so I like to kind of make sure.
Yeah,
that,
okay. Well, I
that
think
Norman's right.
well,
I didn't invent it, but.
Well, we just like to exaggerate a little bit, but it sounded no.
Yeah,
I think
but,
we did think.
actually, Dr. Anil Makar is the inventor, and he's a good friend of mine and a TMJ neuromuscular dentist. And he had made some TMJ orthotics. Actually, this is a kind of a long story, but he made it for a lobster fisherman, and the lobster fisherman was throwing these nets overboard, and his jaw was hurting so bad because of the TMJ that he went and he had an orthotic made. Dr. Makar made him an orthotic, and with the new orthotic in, he not only could throw it farther, but he could throw it pain-free. And so it kind of went from there, and then it went to some hockey teams, and so did some trials with some hockey teams, and it's just kind of grown from there. We've had world-class athletes, Olympic athletes, all kind of professional athletes.
Story.
It's really, I'm a big sports buff too, so just any opportunity to go to games and to be around athletes, I love.
Well, what a great story. Well, and we only have about a minute left, but it was something I do want to say, because you absolutely were like, I want to talk about patient care, when we talk about this, and want to talk about what helps other people, but you have not said anything about this, but we all know, I know, Norman, we were talking about that you and your staff and Carol, your wife, y'all go to, is it Belize?
Right.
And you do a lot of mission work to help people, and you really do give back.
Right. Yeah, we're getting ready to go in February of 2011. We've got our next trip, and that's a real special thing for me and my team that goes with me. And we've got it's really grown over the years. There's just so many people that are involved in it, and it's really our way to give back. And God is good, and we love serving Him.
Well, you do a great job, and I'm going to, like this Halloween, I'm going to trick or treat a lot, and then I'm going to come to the Halloween buyback, because I'm going to make some bucks for everybody. Okay?
Bring your candy.
Bring my candy. Thank you so much.
It goes to the troops.
It goes to the troops. Oh, that's nice. That's great. So they can get cavities, right? No,
we send toothbrushes.
Oh, that's good. Thank you so much. We enjoyed you so
me.
much. It was a great interview.
Thank you
very much.
Thank you so much.